Hi, my name is Kershaw Patel. I'm a cardiology fellow at the University of Texas Southwestern Medical Center at Dallas. Our group's manuscript is titled Prevalence of Apparent Treatment-Resistant Hypertension in the United States according to the 2017 High Blood Pressure Guideline. Our group's work will be published in the Mayo Clinic Proceedings. Among patients receiving medical therapy for hypertension in the United States, application of the 2017 High Blood Pressure Guideline recommendations resulted in a 4% increase in the prevalence of apparent treatment-resistant hypertension, which is approximately an additional 1.8 million individuals. Now, as a brief overview, hypertension is considered a major cardiovascular risk factor. A subset of patients with hypertension have apparent treatment-resistant hypertension, which is defined as blood pressure above goal while taking 3 or more classes of antihypertensive medication at maximum or maximally tolerated doses, or taking 4 or more classes of antihypertensive medications regardless of blood pressure. Patients with resistant hypertension are at high risk for cardiovascular complications. The 2017 High Blood Pressure Guideline recommendations updated prior guideline recommendations regarding blood pressure categories and treatment targets. The prevalence of apparent treatment-resistant hypertension with the 2017 High Blood Pressure Guideline recommendations is not well described. We analyzed data from the National Health and Nutrition Examination Survey from 2007 to 2014. We studied adults in the United States with hypertension who were treated with at least one antihypertensive medication and had their blood pressure measured. We found that 4% or 1.8 million additional adults in the United States with treated hypertension were newly classified with apparent treatment-resistant hypertension. Across sex, age, race, and comorbidity-based subgroups, the prevalence of apparent treatment-resistant hypertension was higher according to the 2017 guideline compared with the prior guideline. Finally, the prevalence of apparent treatment-resistant hypertension has remained unchanged from 2007 to 2014. In summary, the prevalence of apparent treatment-resistant hypertension has increased 4% with application of the 2017 High Blood Pressure Guideline recommendations. We believe that further research is needed to evaluate whether patients with apparent treatment-resistant hypertension, according to the 2017 guideline, are at higher risk for cardiovascular disease. Finally, we believe that additional studies are warranted to evaluate optimal strategies to control blood pressure in this vulnerable population. We hope that you have enjoyed watching this video, and we hope that you enjoy reading our manuscript, and thank you very much for your time.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.